Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Female anatomy and reproductive system. Female anatomy includes the internal and external structures, including those responsible for hormones, reproduction, and sexual activity. /r/n/r/n The female reproductive system is essential for hormone regulation, sexual pleasure, pregnancy, breastfeeding, and more. /r/n/r/n The main parts of the female anatomy can be broken up into external and internal parts. These include external genitalia, internal organs and structures, and breasts, which have internal and external parts. /r/n/r/nVerywell Health acknowledges that sex and gender are related concepts, but they are not the same. To reflect our sources accurately, this article uses terms like female, male, woman, and man as the sources use them. /r/n/r/n The word female is used throughout this article to refer to anatomical reproductive classification and people assigned female at birth based on visible reproductive organs. Some people who identify as women do not have the anatomy depicted, while others who have the anatomy depicted do not identify as women and may use different terminology to refer to their anatomy. /r/n/r/n This labeled diagram and detailed descriptions below explain the location of specific parts to the female reproductive and urinary systems. /r/n/r/n The vulva is made up of the structures outside the vaginal opening. These external structures include /r/n/r/n The vaginal opening is where /r/n/r/n the rest of the female genitalia are inside the vaginal opening. These internal structures of female anatomy include the following: /r/n/r/n At birth, the ovaries are loaded with about 1 million to 2 million eggs. But most will eventually die off naturally via a process known as atresia. At the time of your first period, around 300,000 to 500,000 eggs remain in the ovaries. By age 37, you can expect to have around 27,000 eggs. This reserve will continue to decrease significantly throughout your life. /r/n/r/n The breast contains multiple structures within it, including /r/n/r/n The various parts of the female anatomy serve different functions, which include hormone production, sexual arousal, conception, and pregnancy. /r/n/r/n Estrogen and progesterone are the primary female hormones produced by the reproductive system. Hormone production increases at puberty, giving a person the ability to menstruate and conceive. /r/n/r/n Female hormones also promote vaginal lubrication and increase sexual desire. /r/n/r/n Female anatomy is designed for both intimacy and conception. The vulva, vagina, and breasts are sensitive to being touched, which helps with sexual arousal. /r/n/r/n The role of the clitoris is just for sexual pleasure. It has many sensitive nerve endings that respond to touch. When you're aroused, the clitoris tissue gets bigger, just like erectile swelling in the penis. /r/n/r/n Researchers are not sure if a person's erotic G-spot is an actual structure or a sensitive area in the vagina. You can try to find the G-spot by inserting a finger, palm up, a few inches into your vagina. Then, curl your finger in a come here motion to see if that stimulates the tissue there. /r/n/r/n During ovulation, an ovary releases an egg that travels to a fallopian tube, where it stays for a brief period. If a sperm from semen introduced during penile vaginal intercourse swims to the egg and joins it, fertilization, conception, occurs. /r/n/r/n This creates a zygote, which evolves further as it finds its way to the uterus, where it implants. This is what develops into an embryo. Fertilization can happen hours or days after sexual intercourse. /r/n/r/n If the egg is not fertilized and pregnancy does not occur, the uterine lining sheds instead. This part of the menstrual cycle is known as your period. Most people who menstruate have a cycle every 28 to 31 days, in the absence of pregnancy, but this varies depending on how often they ovulate. /r/n/r/n A number of medical concerns are associated with female reproductive system. Some of these are related directly to the functions of female anatomy, and others are conditions that are common to other areas of the body as well. /r/n/r/n Common medical conditions related to female anatomy include /r/n/r/n The internal and external structures of the female anatomy make up the reproductive system. External areas of the female anatomy include the vulva. The internal anatomy includes the vagina, uterus, and fallopian tubes. /r/n/r/n Female breasts include both internal and external structures. /r/n/r/n These female organs, channels, and types of tissue play important roles in sexual arousal, intercourse, conception, pregnancy, and childbirth. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.